Hi, this is Dr. Kurt Woeller. We know that bowel problems are a big issue in autism. It's almost universal from my experience that small child, a slightly older child, teenager, etc., is going to have some type of bowel issue. Now, there can be a lot of reasons for that. You can have your child may have a hard time having a bowel movement because they just lack the sensation of feeling the need to actually go to the bathroom. You can have kids who have inflammatory bowel problems, which it can be a problem. On the other end of that, they can be severely constipated, and there can be a lot of behavioral things tied up into that. One thing I just want to point out real quickly to you is if you ever see your child posturing themselves over furniture, what I mean by posturing is leaning over the edge of a chair or leaning over the edge of a couch, trying to leverage themselves in some respects, trying to bring some relief, essentially to their abdominal area. And this isn't just more of a playful thing. It's not where they do it for a couple seconds and go away. But this is, I've seen some kids where, they will literally lean over the edge of a table, a coffee table, for example, and be there for, 2, 3, 4 minutes. It looks like what they're trying to do is find a comfortable position. That may, in many cases, is a clear sign of an underlying bowel problem. Could be constipation, where they've got so much stool building up in their abdomen and they're not going every day, and it's causing cramping and discomfort, and they're trying to find a relief point for that, because particularly in small kids, they don't have enough strength in their arms and their hands in order to push in their abdomen to be able to relieve the pain. Can also be an indication of underlying inflammation. So we know that small bowel inflammation can be very painful, and kids will actually kind of try to leverage themselves over furniture to try to relieve that pain. So if you see that type of behavior, recognize it as a potentially an underlying medical problem and seek medical attention. A very simple thing to do with your pediatrician or your family doctor is to get an abdominal x-ray, just an abdominal x-ray, to see how much stool they have built up in their bowel. It may be that your child has a bowel movement every day, but if you're looking at a bowel movement that's maybe that big, which is actually pretty big for a small child, they may have a whole lot left in their belly that needs to come out. So unless you take a look, you won't know. So again, this posturing behavior over furniture, over a couch, over a chair, over a coffee table, even a child who's laying on the ground, laying on their tummy, and trying to roll their tummy back and forth can be an indication of an underlying bowel problem. Make sure you check it out with your doctor, because there's a number of things that you can do to help relieve that, whether it's if they have constipation, doing some things to help relieve that from magnesium or other types of laxatives. And if they have diarrhea and they're doing that type of thing, then you're probably looking at some underlying type of inflammatory problem, or maybe an infection. Doing a stool test or whatnot can be important. So you're always looking for clues for these types of things, and this is a real important one with respect to underlying bowel problems. Thanks.